Dementia is a general term for a group of symptoms affecting memory, thinking, and social abilities severe enough to interfere with daily life. It happens when the brain is damaged by diseases or other conditions, leading to a decline in mental functions. As dementia progresses, it can cause a range of problems in the body, including difficulty with movement, problems with speech, and even changes in mood and behavior. Some medications can contribute to dementia or worsen mental problems because they might affect brain function or interact with other medicines. For instance, certain drugs used to treat other conditions, like anxiety or sleep disorders, can have side effects that impair cognitive abilities, leading to confusion and memory loss. So in today's video, we will tell you about some drugs which can cause dementia, but at the end of the video, we will tell you 3 natural herbs which will help you recover from dementia. So you are requested to watch the video till the end. Please watch, write, share, and don't forget to subscribe to the channel. Number 1, anticholinergic medications. Anticholinergic medications are a class of drugs that work by blocking a neurotransmitter called acetylcholine, which is important for many functions in the body, including muscle movements and memory. These medications are often used to treat a variety of conditions like allergies, depression, and overactive bladder. For example, some common anticholinergic drugs include certain antihistamines for allergies, some types of antidepressants, and medications for bladder problems. However, research has shown that long-term use of these drugs can significantly increase the risk of dementia. This is because acetylcholine is crucial for brain functions related to learning and memory. When these drugs block acetylcholine, they can cause problems with thinking, memory, and overall brain health. Older adults are especially at risk because their bodies may not process medications as efficiently, leading to higher chances of these negative side effects. Therefore, it's important to be cautious with the use of anticholinergic medications, especially for long periods. Number 2, benzodiazepines. Benzodiazepines, commonly known as benzos, are a type of medication often prescribed to help with anxiety, insomnia, and seizures. Popular examples include Valium, diazepam, and Xanax, alprazolam. These drugs work by calming the brain and nerves, which can be very effective in the short term. However, using benzodiazepines over a long period can have serious side effects, one of the most concerning being an increased risk of dementia. Dementia is a condition where a person's memory, thinking, and ability to perform everyday activities gradually decline. Studies have shown that people who use benzodiazepines for several months or years are more likely to develop dementia compared to those who do not use these medications. This is because long-term use of benzos can lead to changes in the brain that affect cognitive function. It's important for anyone taking these medications to regularly consult their doctor, to discuss their risks and benefits, and to explore other treatment options if necessary. Number 3, non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, NSAIDs, are common medications used to relieve pain, reduce inflammation, and lower fever. Examples of NSAIDs include ibuprofen, often sold as Advil or Motrin, and naproxen, commonly known as Aleve. While these drugs are effective for treating conditions like arthritis, headaches, and menstrual pain, using them for a long time can cause some serious health problems. One of the major concerns is that prolonged use of NSAIDs can lead to cardiovascular issues such as high blood pressure, heart attacks, and strokes. These heart and blood vessel problems can reduce the flow of blood and oxygen to the brain, increasing the risk of developing dementia. Dementia is a condition where a person's memory, thinking, and ability to do everyday activities worsen over time. It's important to understand that while NSAIDs can be very helpful for short-term relief, using them for too long or in high doses can have negative effects on brain health. If you find yourself needing pain relief regularly, it's best to talk to your doctor. They can help you find safer ways to manage pain and lower your risk of serious side effects like dementia. Number 4, proton pump inhibitors. Proton pump inhibitors, PPIs, commonly used for their effectiveness in reducing stomach acid and treating conditions like gastroesophageal reflux disease, GERD, peptic ulcers, and Zollinger-Ellison syndrome have been scrutinized for their potential link to cognitive decline and dementia. The proposed mechanism by which PPIs might contribute to cognitive impairment involves several interconnected pathways. Firstly, chronic use of PPIs can lead to significant alterations in the gut microbiome, reducing the population of beneficial bacteria and increasing the prevalence of harmful pathogens. This dysbiosis has been associated with systemic inflammation and alterations in brain function, potentially accelerating neurodegenerative processes. Additionally, PPIs interfere with the absorption of crucial nutrients such as vitamin B12, magnesium, and calcium. Deficiencies in these nutrients have been linked to cognitive decline and dementia. For instance, vitamin B12 is essential for myelin formation and neuronal health, while magnesium plays a role in neurotransmission and synaptic plasticity. Moreover, PPIs can increase the risk of chronic kidney disease and renal impairment, which in turn has been associated with cognitive dysfunction. The long-term suppression of gastric acid also affects the body's ability to absorb certain medications that may be essential for cognitive health. Studies have found an association between long-term PPI use and an increased risk of developing Alzheimer's disease and other forms of dementia, although the exact causative link remains under investigation. Number 5, H2 blockers. H2 blockers like ranitidine and famotidine are medications used to treat conditions such as heartburn and stomach ulcers by reducing the amount of acid in the stomach. While they are helpful for these issues, long-term use of H2 blockers can potentially lead to problems that might affect brain health. One key issue is that these drugs can interfere with the absorption of important nutrients from the food we eat. Specifically, they can reduce the amount of vitamin B12 that gets absorbed into the body. Vitamin B12 is crucial for keeping our brain and nervous system healthy. When the body doesn't get enough B12, it can lead to problems with memory and thinking, which are important parts of how our brain works. Over time, a lack of B12 can contribute to cognitive decline and increase the risk of developing dementia. Therefore, while H2 blockers can be effective for managing stomach issues, it's important to use them carefully and to be aware of their potential impact on overall health, especially if used for a long time. Number 6, antipsychotics. Antipsychotic drugs, such as haloperidol and risperidone, are used to treat severe mental health conditions like schizophrenia and bipolar disorder. These medications work by affecting brain chemicals, especially those involved in mood and thought processes. While they can be very effective in managing symptoms, there is growing concern about their long-term effects on brain health, particularly for older adults. Studies have found that people who use antipsychotic medications for extended periods may be at a higher risk of developing cognitive problems, including dementia. This is because these drugs can interfere with the brain's normal functioning, especially in regions responsible for memory and learning. For older individuals whose brains might already be more vulnerable, the impact can be more pronounced. The risk is not limited to the direct effects of the medication itself, but also includes potential side effects, such as reduced physical activity, which can contribute to cognitive decline. It's important to note that while these medications are crucial for managing certain mental health conditions, their use should be carefully monitored, especially in elderly patients. Doctors often try to balance the benefits of these drugs with their potential risks and may consider other treatment options or strategies to minimize cognitive side effects. Number 7, statins. Statins are widely prescribed medications used to lower cholesterol levels in the blood and reduce the risk of cardiovascular diseases. However, their potential link to cognitive decline and dementia has been a topic of concern and ongoing research. Statins work by inhibiting the enzyme HMG-CoA reductase, which plays a crucial role in cholesterol synthesis within the liver. Cholesterol is a vital component of cell membranes and is essential for the production of neurotransmitters and the maintenance of synaptic plasticity in the brain. By lowering cholesterol levels, statins may inadvertently affect these processes. The brain's reliance on cholesterol for maintaining neuronal integrity means that reduced cholesterol levels could impair cognitive function over time. Additionally, some studies suggest that statins might interfere with the production and function of certain neuroprotective molecules. The potential impact of statins on the brain's vascular health could also contribute to cognitive decline, as the medications might alter cerebral blood flow or the blood-brain barrier. It's important to note that while some research indicates a possible association between statin use and cognitive issues, the evidence is not definitive, and the risk of dementia from statins may be influenced by various factors, including the individual's overall health, age, and dosage of the medication. Therefore, the benefits of statins in preventing heart disease need to be weighed against any potential risk to cognitive health. And ongoing research is essential to better understand the relationship between statins and dementia. Number 8, steroids. Steroids are a type of medication used to reduce inflammation and treat various conditions like asthma, arthritis, and certain types of cancer. They work by mimicking the effects of hormones produced by the adrenal glands, which help control inflammation in the body. While steroids can be very effective in treating these conditions, long-term use can lead to several health problems, including an increased risk of dementia. This happens because steroids can affect brain function in a few ways. For one, they can interfere with the brain's ability to create new cells, which is crucial for memory and learning. Over time, this disruption can lead to problems with thinking and memory. Steroids can also cause other health issues like high blood pressure and diabetes, both of which are known to be linked to a higher risk of developing dementia. Additionally, steroids can lead to changes in mood and behavior, which might contribute to cognitive decline. Because of these potential side effects, it's important for people who need to use steroids to be monitored closely by their doctors. They should use the lowest effective dose for the shortest possible time to minimize risks. It's also crucial to discuss any concerns about memory or thinking problems with a healthcare provider, especially if you've been on steroids for a long period. Number 9, sleep aids. Sleep aids are medications designed to help people fall asleep or stay asleep. While they can be very helpful for some people, especially those struggling with insomnia or other sleep disorders, long-term use of these medications can come with risks. One significant concern is that using sleep aids over a long period might increase the risk of developing dementia. Sleep aids such as zolpidem, commonly known as Ambien, and ezapicolone, known as Lunesta, are often prescribed to help people who have trouble sleeping. These medications work by affecting chemicals in the brain that control sleep. However, when used for a long time, they might start to affect brain health in ways that aren't fully understood yet. Some studies suggest that regular use of sleep aids can lead to cognitive decline, which means that people might have trouble with memory and thinking. This is because these medications can impact the brain's normal functioning, and over time, this can lead to problems with remembering things or thinking clearly. It's like if you were to use a tool incorrectly for a long time, it might start to damage the tool itself. Similarly, if sleep aids are used frequently or over many years, they might end up causing more harm than good to brain health. This is why it's important for people who use sleep aids to regularly review their use with their doctor. Doctors can help figure out the best way to manage sleep problems without relying on these medications for too long. They might suggest other methods for improving sleep, such as lifestyle changes, better sleep habits, or therapy, which can be effective without potentially harming brain health. Number 10, antihypertensives. Antihypertensives, which are medications used to treat high blood pressure, can sometimes cause problems that might increase the risk of dementia, a condition that affects memory and thinking. These drugs, which include common types like beta blockers and ACE inhibitors, are prescribed to help keep blood pressure at a healthy level, reducing the risk of heart disease and stroke. However, some studies suggest that these medications might have side effects that impact brain health. For example, beta blockers, which are often used to lower blood pressure and reduce the strain on the heart, can sometimes affect memory or the ability to think clearly, especially in older adults. Similarly, ACE inhibitors, which help relax blood vessels and lower blood pressure, might also lead to cognitive issues over time. The connection between these medications and dementia is not fully understood, and the risk might be small for many people. However, if someone is using these drugs for a long time, they should be aware of this potential risk. It's important for anyone taking antihypertensives to regularly check in with their doctor, who can monitor their health and make any necessary adjustments to their medication. Number 11, opioids. Opioids are a type of medication used to relieve severe pain, but they come with some serious risks, especially if used for a long time. These medications include drugs like oxycodone and hydrocodone, which are often prescribed for pain from injuries, surgeries, or certain medical conditions. While opioids can be very effective at controlling pain, they can also have negative effects on the brain, which might lead to cognitive problems or dementia over time. When people use opioids for a long period, their brain function can be affected, leading to issues with memory, thinking, and even understanding things. This happens because opioids change the way the brain works, which can impair its ability to process information and remember things. Additionally, using opioids over a long time can make it hard for people to stay mentally sharp, which increases the risk of developing dementia. This risk is especially important for older adults, as they are already at higher risk for cognitive problems. Number 12, herbal supplements. Herbal supplements are often thought of as natural and safe alternatives to conventional medications, but they come with their own set of risks that can potentially affect brain health and increase the risk of dementia. For instance, St. John's wort is commonly used for treating mild depression and anxiety, but it can interact with other medications, including those used for heart conditions and mental health issues. This interaction can lead to serious side effects and complications, potentially affecting cognitive function over time. Ginkgo biloba is another popular herbal supplement, often taken with the hope of improving memory and cognitive function. However, research has shown that while it may have some benefits, it can also cause side effects like headaches and digestive problems. Additionally, Ginkgo biloba can interact with blood-thinning medications, which can lead to bleeding problems. The interactions between herbal supplements and other medications are a major concern because they can lead to imbalances in the body and negatively impact overall health. These imbalances and interactions may contribute to cognitive decline, especially if taken over long periods or in high doses. It's important to remember that just because a supplement is natural doesn't mean it's without risk. Herbal supplements can have strong effects on the body and can interact with other medications in unexpected ways, potentially leading to harmful side effects. Therefore, it's crucial to be cautious and consult with a healthcare provider before starting any new herbal supplement, especially if you are already taking other medications or have existing health conditions. But now we are discuss about 3 natural herbs that are often explored for their potential benefits in supporting cognitive health and potentially helping with dementia. Number 1 is Ginkgo biloba. Ginkgo biloba, one of the oldest living tree species, has been used for centuries in traditional medicine, particularly in Chinese herbalism, to support cognitive health and overall well-being. Its potential benefits for dementia and cognitive function are attributed primarily to its active compounds, which include flavonoids and terpenoids. These compounds are known for their antioxidant properties, which help neutralize free radicals in the body, thereby reducing oxidative stress that can damage brain cells and contribute to cognitive decline. Additionally, Ginkgo biloba is believed to improve blood circulation by dilating blood vessels and reducing blood viscosity, which enhances the delivery of oxygen and nutrients to the brain. This increased blood flow can help support cognitive functions such as memory and concentration. Some studies have suggested that Ginkgo biloba may be particularly beneficial for individuals with mild cognitive impairment or early-stage dementia, as it might help alleviate symptoms like memory loss and cognitive decline. However, the research is mixed, with some studies showing positive effects while others do not find significant benefits. The herb is typically consumed in the form of standardized extracts, capsules, or tablets, and is often used alongside other treatments for cognitive health. It's important to use Ginkgo Biloba under the guidance of a healthcare provider, as it can interact with various medications, especially blood thinners, and may cause side effects such as headaches, dizziness, or gastrointestinal issues. Despite its historical use and the promise it holds, ongoing research is needed to fully understand its efficacy and safety in the management of dementia and cognitive decline. Number 2, turmeric, curcuma longa. Ginkgo biloba, a herb derived from one of the oldest tree species in the world, has long been celebrated for its potential benefits in supporting cognitive health and managing symptoms associated with dementia. This herb is believed to improve blood flow to the brain, which is crucial for maintaining cognitive functions such as memory, focus, and overall mental clarity. The active compounds in Ginkgo biloba, including flavonoids and terpenoids, possess strong antioxidant and anti-inflammatory properties that help protect brain cells from oxidative stress and inflammation, 2 factors thought to contribute to cognitive decline and dementia. Some studies suggest that Ginkgo biloba may enhance cognitive function and slow the progression of dementia, particularly in individuals with mild cognitive impairment or Alzheimer's disease. However, while research shows promise, findings have been mixed, with some studies reporting beneficial effects and others seeing little to no improvement. Additionally, Ginkgo biloba can interact with other medications, especially blood thinners, increasing the risk of bleeding complications. Because of these potential interactions and variable research outcomes, it is important for individuals considering Ginkgo biloba to consult with a healthcare provider. They can provide guidance on appropriate dosages, potential side effects, and interactions with other medications. Overall, while Ginkgo biloba may offer some benefits for cognitive health, it should be used with caution and as part of a broader approach to managing cognitive function in dementia. Number 3, rosemary, Rosmarinus officinalis. Ginkgo biloba, a herbal remedy derived from the leaves of the ginkgo tree, has long been celebrated for its potential cognitive benefits and is frequently explored as a supportive treatment for dementia. This herb is believed to work primarily by enhancing blood circulation to the brain, which is crucial for maintaining healthy cognitive function. Ginkgo biloba contains flavonoids and terpenoids, which are compounds known for their antioxidant properties. These antioxidants help combat oxidative stress, a condition characterized by an imbalance between free radicals and antioxidants in the body, which can lead to cellular damage and contribute to cognitive decline. By reducing oxidative stress and improving blood flow, Ginkgo biloba may help protect brain cells from damage and support memory and cognitive functions. Clinical studies on Ginkgo biloba have produced mixed results. While some research indicates that it can have beneficial effects on cognitive function and may slow the progression of dementia symptoms, other studies suggest that the evidence is not strong enough to make definitive claims about its efficacy. Nonetheless, many people turn to Ginkgo biloba with the hope of improving their cognitive health. It is usually available in various forms such as capsules, tablets, and liquid extracts. However, it's important to approach Ginkgo biloba with caution, as it can interact with certain medications, particularly blood thinners, and may cause side effects like headaches, dizziness, or digestive issues. Thank you very much for watching the video till the end. I would request you to subscribe to the channel, and if you have any health-related problem, then definitely take advice from your healthcare expert.